So one of the things that I think is very interesting about this conversation is that when we talk about resilience, we often mean different things from the same word. So I think about there's a whole panoply of definitions of resilience and kinds of resilience. Most of the report talked about the physical resilience, the resilience of our physical infrastructure, things that can be influenced by building codes, zoning codes, incented by insurance and concepts of risk. We also talked some about health resilience and the resilience of individuals and their own health and the resilience of the health care system. Another kind of resilience that's key, and we've certainly seen this in Katrina and in Sandy, is ecological resilience, the ability of the ecosystem to bounce back, and then how the ecosystem resilience and human resilience intertwine. We talk about psychological resilience and the resilience of people themselves being able to bounce back. We look at organizational resilience. If an organization's infrastructure is destroyed, can it reconstitute and can it come back? And we just had some interesting discussion from Admiral Allen about reconstituting components of government in a functioning city after Katrina. Economic resilience, another kind of resilience, and all of those different factors are terribly important. What I enjoyed about the last panel so much was this discussion about the fact that social connectedness underpins all of this, and the emerging literature that individuals and communities that are better connected socially bounce back better, do better as individuals and do better as communities, and actually are able to better access the resources for their communities to rebuild. So then I think about, well, what do we do at the federal level? What do we do in my organization to help to promote resilience? And obviously there's lots of planning that we do in many ways. Some of the newer things that we're doing are trying to promote that human resilience, those connections between people. So for example, we've been experimenting with the development of Facebook apps that ask people to identify their lifelines in advance of a disaster. Who can you count on in an emergency? Who will bail you out? If you have to evacuate, where are you going to go? Build those connections between people. In Hurricane Sandy, an innovation team from HHS and FEMA went down to New York and started setting up communication networks, local Wi-Fi, so people who were disconnected could actually get online in a shelter or at a FEMA hotel and be connected to friends and relatives and to their own social network. So trying to reconstitute and help develop and build that social fabric. If that's not their day-to-day, it's not likely that it's going to be there on game day. Just as if our other systems don't perform day-to-day, they're not going to perform on game day. So building those day-to-day systems that we need for resilience is terribly important. Then they're there when you need them.